Dr. TANISH GARG. Yeah, why don't you go ahead? We are not able to see anything on the screen, please.
Good afternoon, everyone. My topic for today is approach to dacryocystitis, insight from culture sensitivity and histopathology in DCR patients. Next. It's not changing. It's not working. Change. Objectives. Primary objective of this study to determine the common organism and their antibiotic sensitivity in patient of dacryocystitis who are undergoing DCR surgery. Secondary objectives to formulate a better antibiotic cover for the patient undergoing DCR surgery. Materials and methods. So this is a prospective study. Study population of the patient with NLDO block causing chronic dacryocystitis. Duration of the study was 6 months from November 2023 to April 2024. Exclusion criteria of the cause of secondary cause of NLDO block or repeat of failed DCR cases. Sample collection. Intraoperatively during the procedure directly from the sac using sterile cultures where the pus was collected. Investigation culture was done using blood agar, eosin methylene blue, chocolate agar and seborrheic agar. Antibiotic sensitivity were tested using Vitek to compact method or instrument. Along with the culture and sensitivity, lacrimal sac flap was sent for histopathological examination. Results and discussion. A total of 45 patients who underwent DCR were analyzed. The gender distribution was 3:1. A total of 35 patients came positive for the culture. And on histological examination, 45 samples showed chronic inflammation. The mean age of 48 years, which was seen in all the previous studies, and the female to male ratio of 3:1 was also seen in previous studies. 13 different organisms were isolated. Among positive samples, 48% of them were gram negative and 41 were gram positive.
Excuse me.
So this is also, it's not working. Among the gram-negative organisms, Pseudomonas aeruginosa was the highest in number, and among gram-positive, it was Staphylococcus aureus. Although gram-positive organism has been reported as a common cause in different studies conducted in different parts of the world and in India also, higher number of gram-negative organisms were isolated in our study, which was similar to the studies conducted in Turkey. Pseudomonas and Staphylococcus aureus were the most common organism in our studies, which has been similar to the other studies. However, in other studies, pneumococci and Haemophilus were also very common, but in our study, we didn't find a good number of these organisms. On antibiotic sensitivity, gram-positive bacteria showed highest sensitivity to gentamicin, trimethoprim, daptomycin, and linezolid, that is 100%, followed by 93% sensitivity to tetracycline and vancomycin. Gram-positive showed least sensitivity to ciprofloxacin and levofloxacin, on 43% were sensitive to these antibiotics. Antibiotic sensitivities in gram-negative show highest sensitivity to cephalosporin and meropenem, followed by 90% sensitivity to amikacin, gentamicin, trimethoprim, imipenem, and least sensitive to colistin and ciprofloxacin, that is 76 and 80% respectively. Antibiotic sensitivity in our study was similar to the trend shown in Turkey and Syed, which was conducted in Lucknow. However, comparing it with the studies conducted in Iran, it showed a different trend where the ciprofloxacin is the most sensitive antibiotic along with vancomycin. Conclusion: the bacteria that were most isolated, often isolated from individual with chronic dacryocystitis in our investigation were Pseudomonas aeruginosa and Staphylococcus aureus. The finding demonstrated that quinolones like ciprofloxacin and levofloxacin are less effective against both gram-negative and gram-positive bacteria. Therefore, in our area, individuals with chronic dacryocystitis may benefit more from empirical antibiotic treatment with aminoglycosides and folic acid inhibitors rather than quinolones. Since these studies results are preliminary, further extensive research should be conducted to support them. Patients with chronic dacryocystitis may have changed their antibiotic bacterial profile and resistant to antibiotic over time. They must be under constant observation and supervision. No, ma'am. It was positive in 35. Out of 45, 35 was positive. 10 were not, no growth. No. During this study, we had given before only. We have not waited, but after we will forward.
So did this study make you change your approach as to which antibiotic
actually
you
we were giving ciprofloxacin more often in our college, so now we will change it to the, because ciprofloxacin showed least sensitivity in gram-negative and gram-positive both bacteria.
So now which one are you preferring?
Now trimethoprim will be a better option.
No, which one do you actually give?
Like we have to start now. Usually we'll give ciprofloxacin only, but trimethoprim is a better option according to this study, because gentamicin and all are severe toxicity and different side effects also.
Okay.
Yes, okay.
Have you seen any infections post DCR?
No, sir.
Because what you had put up on the first slide was that you wanted to know what antibiotic to give after DCRs, right? So in spite of ciprofloxacin, you did not have any infections in the wound as such.
Yes.
So what was the point in doing the study for that? It would be more for treating an acute dacryocystitis rather than a perioperative cover, right?
The antibiotic sensitivity might change, and like different organism has been identified in different areas. So in case if there is any complication occurs, so we will be able to have some idea because of which it can occur and what are the antibiotics which are more useful in this.
In all cases of DCR, you have done this culture for the study period, or anything like repeated acute dacryocystitis or something?
Not all. The patient undergoing DCR due to traumatic NLDO block or repeat DCR or failed DCR, we have not taken the sample.
Excluded. No.